Malnutrition actually encompasses both overnutrition and undernutrition, and really we understand about undernutrition, and it's about not having enough energy, protein and other nutrients to perform body functions and also to support clinical outcomes. A recent report in 2009 has indicated the incidence of malnutrition in the UK to be around 3 million people. If we look specifically in hospitals, a report by Bapen in 2008 showed that 28% of individuals are at risk of malnutrition. In care homes, it's a lot higher, at 42% of individuals being at risk of malnutrition. And also a recent report in sheltered housing has shown around 14% of individuals at risk of malnutrition. So it's a very prevalent problem. It's under-recognised and under-treated. In those same reports, it's also shown that malnutrition is extremely costly, and it costs the public in excess of £13 billion every year. Really, one of the main causes of malnutrition is that of disease, and we actually call malnutrition disease-related malnutrition. And things within disease that can cause malnutrition include increased requirements for nutrients, increased losses of nutrients, and of course overall the reduced intake, so not having enough nutrients within your diet. There's actually lots of consequences of malnutrition, and they can affect people both clinically functionally and also economically on the wider healthcare system. For example, it can affect muscle, and you can have muscle wasting. It can affect your immune function, and you have reduced immune function. You may have impaired wound healing. For the patient, there will be a reduced quality of life. And actually there is evidence to show that malnutrition also increases visits to the GP, increases admissions to hospital, and also length of hospital stay when you're in hospital. There is a way of diagnosing malnutrition. To understand if somebody is malnourished or not, we would screen them for malnutrition. There is a tool that's recommended for screening called the Malnutrition Universal Screening Tool, or MUST for short, and this has been developed by Bapen. And the NICE clinical guideline, developed in 2006, recommends screening by healthcare professionals across all care settings, and that a screening tool should look at BMI, percentage weight loss, and the acute disease effect. And they actually recommend that MUST could be used to do this. Malnutrition can be treated. Again, the NICE guidance recommends you can treat malnutrition with oral nutrition support. This can include oral nutritional supplements like Fortisip. It can also include advice from a dietitian or food fortification, or sometimes simply altered diet like including snacks into your diet. And again, NICE recommends oral nutrition support for all individuals who are malnourished or at risk of malnutrition.